A pancreas transplant is surgery to implant a healthy pancreas from a donor into a patient with diabetes. Pancreas transplants give the patient a chance to become independent of insulin injections. Dr. Clarence Foster of UCI Medical Center in Irvine tells us of the procedure and its benefits.
The pancreas is an organ in the body that's important for secreting several important hormones. The most important one is insulin. And insulin is what helps us control our blood sugars. A pancreas transplant is what we consider to be a surgical cure for type 1 diabetes. It's when we do a pancreas from a donor into someone who needs a pancreas transplant because they are type 1 diabetic. We take an organ from a donor and give it to a patient to cure their diabetes. Typically, it does not apply to someone that has pancreatic cancer. If they have a benign form of a tumor in their pancreas, or if they had a chronic inflammation of their pancreas, we could use a pancreas in those patients to do a pancreas transplant. So a patient that undergoes pancreas transplant first must have a complete comprehensive evaluation done by our transplant surgical team here at UCI Medical Center. They're seen by nutritionists, social workers, transplant nurse coordinators, and most importantly for a type 1 diabetic, we make sure that their heart is okay and safe for proceeding with an operation. And after they've completed their testing, they're selected to be put on a waiting list so that ultimately we can get them transplanted with the pancreas. A patient that undergoes a pancreas transplant here at UCI Medical Center is typically in the hospital for 7 to 10 days after the pancreas transplant. The success rate of pancreas transplant is actually quite good because we're very sure that we pick an organ or pancreas that's going to be successful. And also, we measure our success as a patient completely off of insulin. So when you look at patients that are completely off insulin, 90% of them are completely off insulin at 1 year after undergoing a pancreas transplant. The most exciting thing for us in transplantation of the pancreas is the possibility of doing islet cell transplants. The islet cells are a part of the pancreas that are important for producing insulin. And we here at UCI Medical Center are working on trying to just use that part of the pancreas to cure diabetes. The problem with that procedure today is that oftentimes it requires more than one pancreas to get a patient off of insulin, and the long-term results of it aren't proven. But that is where the research is heading in terms of pancreas transplants, trying to use just part of the pancreas in order to get them off of their insulin. The most exciting thing about a patient that has been on insulin their entire lives and have been having problems controlling their sugars, when they come back to you and they realize they don't have to take insulin anymore, it's very exciting to hear from them how free they feel, that suddenly they can go about their lives and not worry about passing out. I love doing transplants in those patients because you get the most benefit, because they've oftentimes spent 20 years of their lives with diabetes and difficult to control sugars, and suddenly 2 weeks later they're completely off of their insulin and their diabetes has been cured.